Hello, everybody. Welcome to the webinar. Thanks for joining today. I'm going to try and share my screen. And I'm trying to go into slide show mode. There we go. Does it look to people like I'm in slide share mode?
Yep, you're great.
Okay, thanks. All right. So the purpose of the presentation today is to provide some background information on our Marshfield Clinic Research Institute, and also use this presentation as an opportunity to talk about a new project we're involved in called Connect for Cancer Prevention, which we think may be of interest to you all and to Security Health Plan members in your groups. So the overview for today is a few slides about the Marshfield Clinic Research Institute, including areas of research, the fact that we have system-wide access to research studies, and some interesting different types of studies that we're involved in, and then use the Connect for Cancer Prevention study as an example to talk a bit more about the way that we do research and the opportunity that it affords to people in our health system service area and in Security Health Plan membership for participating in an important new project focused on cancer, developing information about cancer prevention. So some of you may be familiar with the Marshfield Clinic Research Institute. Some of you may not. It's worth pointing out that our mission is that we enrich lives through the discovery and application of scientific knowledge. That's the sort of opening to our mission. And the vision clarifies that we want to use that scientific knowledge to help innovate and define how healthcare is provided in the best way possible for generations to come. The Research Institute focuses primarily in 4 areas of research. For the longest time, we've been engaged in rural health and safety research. The very first federal grants that the Institute received back in 1960 were focused on understanding farmers' lung disease and eventually discovering a test to identify farmers at risk and help with prevention of farmers' lung disease. And in 1981, it led to the creation of our National Farm Medicine Center, which continues to operate today. Secondly, cancer care and other clinical research. This is patient-focused research and typically offers patients access to cutting-edge clinical trials that offer the newest treatments and diagnostic methods that are being evaluated. And this department also supports physician researchers in areas other than cancer across a wide range of clinical topics. We have a center focused on precision medicine. This is researchers who are focused on the genetic basis of disease, the influence of someone's genes on disease risk, the ability to search for biomarkers that can help prevent or detect illness, and moving toward more individualized treatments. We're all different. We have different underlying characteristics, and that can influence whether a given treatment works well for someone or not. And precision medicine helps, that research helps us figure that out. And then finally, the center that I'm in, we're focused on population health and epidemiology. We study both infectious and chronic diseases in large populations with a goal of understanding how disease works to improve health for patients and communities. And across all of these 4 areas, we work closely with our research and development lab and with the team that's focused on research, computing, and analytics. The research we do is system-wide, even though Marshfield is our home for the health system corporate offices and for the Marshfield Clinic Research Institute's main building. We operate research as a system-wide activity. The Institute has 220 staff, including 45 doctoral level researchers. In 2022, we received $36 million in research grants from federal, state, and private sources, and carry out at any given time over 300 research projects, including importantly, 20 projects funded exclusively by generous donors to the Marshall Clinic Health System Foundation. We have clinical research offices in 6 of our centers named here, but we also are able to carry out research through project outreach to any of the 45 communities that have health system locations, depending on the nature of the study and what that study needs. And for some studies, participation is completely system-wide. That is, anybody that's part of our health system might be eligible to participate. And then finally, I want to say a little bit about the different elements of research that we're involved in. Research can be laboratory-based, where we're working with clinical or donated biologic specimens specifically for research. Our research can be environmental or field-based, where our teams are out in communities. For example, studies focused on vectors of disease like ticks and the diseases that ticks can spread, or farm exposures that may raise the risk of injury or perhaps reduce the risk of asthma or other allergic conditions. A main type of research we do is observational medical record database research, where we use information on thousands or hundreds of thousands of patients collectively to look for informative patterns, that will help us understand how disease works. We have patient-focused clinical trials where we test how well new medications and other clinical interventions work on in the patient setting. We also carry out work focused on advocacy and intervention in communities, working with communities and policy groups, for example, to improve health. The picture here is of a recent symposium focused on mental health and suicide in farmers and farm workers. And then we also are involved in recruitment-based studies, where we identify people that are eligible and relevant to a given study question and invite them to participate in the project and collect information from them, both for short-term projects or long-term follow-up studies. And it's true that often studies will include multiple elements, like the one that we're about to talk about now, the Connect for Cancer Prevention study. So thanks for letting me say a little bit about my research home at Marshall Clinic Research Institute. But now I want to turn to information about one of the studies that I'm involved in called Connect for Cancer Prevention. I want to provide some background on why we're doing this study. It's recognized that there's a huge burden on the population from cancer. Even to this day, 1 in 3 people will develop cancer in their lifetimes. And we've recognized that well-established infrastructure for basic sciences and for clinical trials have led to big improvements in cancer medicines in recent years, increasing cancer treatment's ability to cure patients or extend their survival. However, research into cancer prevention, early detection, and survivorship after cancer treatments are done have lagged behind without as much critical infrastructure in place. Also, at the same time, we have a growing understanding that there are substantial variation across tumors, even of the same type, that can be associated with important differences in how a given tumor responds to treatment and what the patient's outcome is. And so it's important that we understand more about those biologic differences. And then ultimately, for any given type of cancer, there's not just a single cause. Each person has a different underlying genetic makeup and a different set of life experiences and exposures that interact over time to influence their risk of a cancer developing, or the pace with which a developed cancer progresses to a more serious form. And because of these recognition of gaps in our knowledge, the Connect for Cancer Prevention study is targeting filling in those gaps. So our main objective is to better understand the causes of cancer and how to prevent it. We're doing this by creating a large research platform that will be able to be used by scientists for many years to come, using the newest technologies and methods, including some that aren't even available yet, but will be developed in the future, to study the causes of cancer, how to predict who's most at risk of developing cancer, what factors influence someone who has a precursor lesion, that's a precancerous lesion that might progress to a more invasive or more serious form of cancer, how best to detect cancer early, and how to assure the best and longest quality of life for cancer survivors. These are the kind of questions that we want to answer with this large research platform known as Connect. And on the bottom left, it shows our tagline, which sort of sums up the value equation for why we think people in our communities might want to participate in Connect, and that is connect today, prevent cancer tomorrow. Some details about how the study is designed. This is a project led by the National Cancer Institute in Bethesda, Maryland. Our goal across the entire study is to recruit 200,000 adults. We're conducting this study within healthcare systems. There are 10 systems, including Marshfield Clinic Health System as one of them. Subjects of interest for recruitment are aged 30 to 70 years and have no history of cancer. People will be able to enroll and participate in the project primarily online through the web or through mobile apps on their mobile device. And that includes enrolling, filling out their informed consent, and completing surveys. Biospecimens will be collected in person at one of several health system locations across our health system. And subjects who participate in Connect will contribute information at enrollment, plus every year or two, with regular study communications back to participants every 6 months or so. And then we want to follow subjects in the study for a long time, 10 to 15 years or more. And we're going to follow them as efficiently as possible via medical record linkages, data linkages to external databases and repositories in order to identify who develops cancer and who doesn't, and other important health outcomes. This slide is a little busy, but it helps explain why we're going to be following subjects for a long period of time. The line in red that rises on the right-hand side, maybe you can see my cursor. I'm hoping that maybe you can see my cursor. I'm pointing to this red line. And that shows the incidence of cancer by age. And as many people know, the incidence of cancer goes up quite a bit as one gets older. And so the theory behind this project is by recruiting subjects who have not yet developed cancer earlier in life, when they're experiencing life exposures that potentially put them at risk of developing cancer later on, and collecting information from them in an ongoing fashion, we'll be able later on to compare those who develop cancer and those who don't, and the various intertwining exposures that people have had, both from their genetics, from other clinical conditions, their health behaviors, environmental exposures, and so forth. This is a map that just shows the 10 health systems that are participating in the study. Marshfield Clinic is shown there in brown in the center of Wisconsin, center and northern part of Wisconsin. We're partnered with Henry Ford Health System in Detroit, Health Partners in Minneapolis, the University of Chicago, Sanford Health in the Dakotas, Bader Scott and White in Texas, and then 4 different subsets of Kaiser Permanente, which are health systems across the country, but the ones participating are in Georgia, Colorado, Portland, and in Hawaii. So now I'm going to tell you a little bit about how we're conducting this study in the Marshfield Clinic population. One of our first pieces of activity in participating in the study was to identify the size and individuals who are eligible to participate in the study amongst our patient and membership populations. It turns out that with these 3 criteria, ages 30 to 70, no personal history of cancer, and either being someone with recent security health plan enrollment and at least 1 visit in the past to Marshfield Clinic, or a recent in the past 5 years Marshfield Clinic primary care patient. If someone has those characteristics, we enumerate that to be about 180,000 people across Marshfield Clinic Health System and Security Health Plan. They're found across our entire health system. This map here has some areas that are super light blue, so they look white, but actually the catchment area for this study is our study catchment area, or our health system catchment area. I mentioned earlier that we're collecting biospecimens in person, and so we're initially targeting people who live near our open biospecimen collection centers in Lake Hallie, Marshfield, Wisconsin Rapids, and Weston, and Minocqua. And in the coming year, we'll be opening up sites in Rice Lake and Merrill and Colby, Abbotsford. We started this project in 2021 as a pilot enrollment to see how we could do and what works and what doesn't work. So we had initial funding from the National Cancer Institute to sort of ramp up our ability to participate in this project. We're now moving in 2024 to full-scale recruitment, and we'll be recruiting for the next 4 years or so. And then we'll be following people for an additional 5, 10, or more years after 2028. Our goal, our expectation from the National Cancer Institute is Marshfield Clinic Health System will recruit 11,000 participants during this project. So 11,000 out of the 200,000 will come from Marshfield. We're the smallest site of the 10, but we're doing a really good job with recruitment to date. Operationally, we send out about 600 invitation letters per week randomly to eligible people living near one of our 8 biospecimen collection locations. And we also send at appropriate points follow-up text, emails, or phone calls to make sure that people are aware of the project and can contemplate whether they'd like to participate or not. Recognizing that our system service area is very large and not everyone lives close to one of those 8 locations, we're periodically holding what we're calling pop-up recruitment collection clinics at other locations to try and afford the opportunity to those living farther away the chance to come in and give their biospecimen donations. Then once someone enrolls online, they're asked to complete surveys on their overall health, medication history, reproductive history, exercise, sleep, smoking, alcohol exposure, sun exposure, and residential and occupational history. And then we contact them or allow them to self-schedule a biospecimen collection appointment at one of the open centers of their choice, and that appointment takes about an hour of time. This study is leveraging modern technology, and there's a mobile device app that many study participants use for their entire engagement with the project, both to enroll and complete their surveys, as well as to receive reminders and participate in various study activities. Eventually, we'll be using the app as well as other communication methods to return results on particular genetic or other testing that develops over the course of this project. And we'll also be collecting new information from participating subjects using mobile or wearable technologies as they become more prevalent in the future. We're working hard to promote the study in our region. Within the clinic health system structure, we're using banners and posters as well as brochures to let people know that we're launching this full recruitment for the Connect study. We have created information sheets for staff and providers to tear off and give to patients, sort of like prescriptions to encourage patients to consider whether they might be interested in this project. And we're also using other communication methods to try and get the word out. We're coordinating with the Marshfield Clinic Health System Foundation on fundraisers for cancer research resources, because we recognize that people who participate in philanthropy for cancer research might also be interested in participating themselves in this long-term project. And we're attending community events across our health system to get the word out. I just wanted to provide a slide that lets people know how we're doing to date in terms of enrollment. So we're trying to reach 200,000 people across the entire study over the next several years. We've already enrolled 30,000 people in the pilot phase across 10 health systems, and 2,300 of those are from Marshfield Clinic Health System and Security Health Plan. On the right, the different cumulative participation curves are shown. The sort of chocolatey brown curve, which is the fourth one up, is Marshfield Clinic here. We are, as I mentioned, the smallest site. And so we're really outperforming a number of the other sites in terms of the enthusiasm and participation rate for our underlying population in this project. Importantly, we want Connect to recruit not just a lot of people, but also make sure we recruit people who come from all walks of life, all different backgrounds and characteristics, so that the results are the results of our research in the future will be applicable to as many groups as possible. So what can people do if they might be interested in this project, or they think that their populations might be interested in this project? You can learn more from the study website, which is www.cancer.gov/connect prevention study, with some dashes in there. I'm certain that we can, either through the recording or other means, make sure that people are aware of what this website address is. You can also reach out to me. I'm the principal investigator at Marshfield for the project, or to Tammy Ellis, who's our site study manager for Connect. We'd be very glad if you'd consider making Security Health Plan members aware that if they are between the ages of 30 and 70 and have no history of invasive cancer, that at some point over the next several years, they may be recruited to participate in the Connect study, which likely would reach them at first through an invitation letter and then other electronic means as well. It's important for people to know that they don't have to wait to be randomly invited to participate, that passive enrollment is also an option. Those who learn about Connect through our various promotional efforts and materials, community events, word of mouth, through anything that you might pass along to people in Security Health Plan, and they think they would be eligible. That is, again, using those three criteria: age 30 to 70 at the time of invitation, no history of cancer, and either a year of SHP enrollment or at least one Marshfield Clinic Health System primary care visit in the last 5 years. Those people can enroll online at any time through the study website, and we would just, because we didn't reach out to them directly, would verify their eligibility by comparing to our local health system eligibility pool. And then if they're part of the pool, they would be verified and included in the study. So I just want to end by encouraging people to explore this opportunity to contribute in this national effort toward critical scientific discoveries in the future that will help people prevent cancer, detect it earlier, and live after diagnosis with a higher quality of healthy life for a longer period of time.